So welcome to this Digital Infoday Session. This webinar is going to cover issues that are faced by families, friends, loved ones of those diagnosed with myeloma. So we'll be sharing some hints and tips on how to provide support, how to take time out and focus on yourself. And the webinar is being recorded and you can watch it shortly afterwards on our Facebook page and on our website. If during the webinar you'd like to chat to each other, you can use the chat box at the bottom. And if you have some questions for the speaker, please use the Q&A box at the bottom as well. So I'm just going to introduce myself. My name's Ellen. I'm one of the myeloma information specialists at Myeloma UK. So my main role there at Myeloma UK is to answer the free phone helpline, our myeloma info line, and to answer any queries that come into our Ask the Nurse at myeloma.org.uk. If you phone the helpline, chances are you'll get me or one of my colleagues, Sarah or Kim. We are a patient-focused charity. We aim to empower, inform and support patients and their loved ones in everything they do. As an organisation, we do rely on the generosity and kindness of supporters fundraising and donating. Myeloma UK doesn't receive any core government funding, so your support is absolutely vital and we're truly grateful for all the contributions which allow us to continue to do our work. So this evening, I've got a bit of a superstar to welcome. We've got with us this evening, I'm delighted to say, we've got Lisa Ferguson, who is myeloma advanced nurse practitioner at Churchill Hospital, Oxford University Hospitals NHS Trust. Thank you for speaking this evening, Lisa, and I'll now hand over to you for your presentation.
Thank you very much, Ellen. It's a pleasure to be here this evening. It's a pleasure to have you all here today. So this presentation is going to cover who a carer is, how you can look after yourself as a carer, and the practical hints and tips to help you cope with this role. Now, probably looking at what is a carer and am I a carer? Now, most people don't think of themselves as a carer. They don't think it describes what they're doing, as if it's your family member or you're a friend of somebody that you are looking after. You feel that it's just something that you would be doing anyway, and it's just something you're there for them whilst they're going through that rough time. So if I'm looking down, I'm just checking my notes so I'm not missing anything. So the term carer is something that a lot of people will find alien, and you do think it's an extension of your role as either their family member, their loved one, or their friend. But it is really important to recognise yourself in this role, because you can help get the access and to support and help that you may need. So before we go further in this presentation, it's probably really important to identify who is regarded as a carer and what that role entails. Now, Carers UK have identified that there are approximately 6.5 million people in the UK who are carers, and that's 1 in 8 adults who provide unpaid care to friends and family. They estimate that this figure is continuing to rise, and there'll be around 9 million people that identified as carers by the year 2037. Now, a definition of a carer is someone who provides unpaid care and support that someone relies on. Now, this can be practical, emotional, or social support. Now, the importance of identifying yourself as a carer means that you get access to the help and support that you need. Now, remembering that the care that you provide someone comes in many different forms, and even if you're not the main source of care for somebody, you may still help them in a very important way. Some of the activities that can be provided as caring are helping with sort of the housework and tasks, providing emotional support and companionship, socialising with the patient or supporting them to socialise, helping with transport or running errands, helping with medication and hospital appointments, and also helping to find information about myeloma and its treatments. That brings us on to sort of caring for a patient who has myeloma. Now, in general, caring for someone can be very unpredictable and demanding. And it's often difficult to manage alongside other responsibilities that you might have, for example, working or looking after the rest of your family. You can also become a carer very unexpectedly, which can mean that you take on tasks and responsibilities that are new for you, which can be things like cooking, housework, or even managing the family budget. And then on top of that, you have myeloma, which is a complex and very individual cancer. And it brings along its own unique set of challenges. You need to learn to navigate the healthcare system, being aware of the different treatments that that person might have, and getting to grips with all the side effects and complications that could come alongside those treatments. And myeloma treatments are quite complex, and we know that there are significant complications and side effects that come alongside that. When we look at the challenges of caring, obviously there's a concern for your loved one, understanding of the healthcare systems, which can be very tricky at times, the high demands on your time and your energy, the financial uncertainty that it might bring, as well as shifting roles and responsibilities within your dynamic and your relationship and changes that can happen. And also that isolation and that feeling of being isolated. Caring can be feeling very isolated, especially if you live with the person that you're caring for. It can feel all-consuming, and you might feel that all your time and energy is taken up with that looking after that one person, and you may feel like you're getting yourself lost with knowing who you are. When we talk about changing roles, it can be specifically when it's a child looking after their parent. Trying to make suggestions about things that will make lives easier can be difficult because it's not seen as your role as a child to be telling your parents what they should be doing or what might be the better thing for them to do. So it can be very difficult if that is the situation you're finding yourself in. The emotional impact that it can have on you, feeling angry that you're not going to get the future that you wanted, but the hardest thing most people find is about being in limbo. Now, obviously, the emotions are normal, but it can be very hard to deal with. So looking at emotions now, it's normal to have those mixed emotions, including resentment, anger, and guilt. One of the best things to do is to be open and honest about how you're feeling and avoid suppressing the emotions or avoiding talking about them, as that can be very, very tiring and usually unsuccessful and can result in blowouts and having arguments when you maybe don't need to. One of the big things that people can struggle with is that feeling of guilt. Now, it is normal to have good and bad days, and normal to have those bad days when something isn't going well, but you can feel really guilty for it, and really guilty about feeling those ways when you're not the patient. But it is perfectly normal to have these feelings. So it's a very common thing for carers to feel. And what we say is to not set unrealistic expectations of yourself from caregiving, and being aware that asking for help or taking time off is really important for you to manage your own health and well-being, so you can continue to be there as that support for your loved one. Feeling guilty is not uncommon. It can come from setting yourself those unrealistic expectations, and the annoyance and resentfulness that some people do feel as well is something that can be quite common too, and is often because you jump into this caregiving role with very little notice of having to do it. So one of the most important things is to try, I was about to say looking after yourself, but I think we might have a question and answer session.
So yes, we do indeed. Thank you, Lisa.
Okay.
We do indeed. I was waiting for that screen to pop up, and then I would know that was my prompt. So yeah, no, we come to the first part of our question and answer session, and we have had quite a few questions submitted. So we'll take a few just now. We're going to take a few more later on as well. So thank you for submitting those questions and taking the time to do that. We do appreciate it. So the first one, Lisa, comes from Rachel. How do I support my loved one when they have so many worries and fears about myeloma? It can be overwhelming.
Yeah, it can be. It's very true. I think one of the most important things is to be there to listen to their concerns. Probably not trying to address them all, but even being there to write down those questions to then be able to go to the right people to talk to them about, if that's either yourselves at Myeloma UK or the specialist nurses or the consultants of the team, but to just be there so that the patient is feeling heard. And, it is that, problem shared is a problem halved sort of thing. Having it out of their head and with somebody else as well helps them to relax. But probably just more importantly saying, don't expect to be able to answer all of those things and take them all on, but know that there are people out there that you can go to get additional help for with regards to those sort of concerns and fears that the patient has.
Thank you, Lisa. Yeah. So we have a question from Stephanie. Stephanie says, is it worth telling your GP that you're a carer?
Yes, it definitely is worth it. For your GP to be aware that you're a carer, they'll be aware of potential stresses and strains that you might come under. And that means if you do get overwhelmed at any point, the fact that they know you're a carer, they can help you get additional support and they can refer you into other services that can be helpful.
Absolutely, yeah. And Elizabeth asks a question, what's the best balance of caring for your loved one as well as caring for yourself?
Well, that's a very good question. I know when you're in the mode and it's your loved one, you're probably going to want to make sure they're okay more than making sure you're okay. You'd probably want a bit of a 50-50 balance. And if you've got other people around that you can share that role of being a carer with, that is going to be the best thing to do. It is really important that you're looking after yourself, because if you burn out and you're not there, you can't give your loved one the support that they really need, and you'll feel guilty about that. So it is definite. You're just as important, sometimes more so if you're their main carer, for you to be looking after yourself.
I agree, and this is something that we get asked quite often too on the helpline. So I do agree, the carers need to look after themselves. If they become unwell, then then they're not doing anybody any favours, really, mostly themselves. So here we have one here. I guess the inevitable COVID question had to pop up. So here we are. So what help is out there for carers who are feeling their mental health decline in these times of COVID?
So I think, the help that's out there is probably the same as what it was in a sense, although there may be more people tapping into it. So I think if you're struggling from a mental health side of things, you really need to contact your GP. Letting them know that you're a carer, if they don't already know, is really important, because obviously it will have an impact on them being able to prioritise what they can offer you as well, if they know that there's somebody else that is relying on you to be able to be there and function as well for them. So I think, as soon as you're struggling with those things, you reach out to your GP. Certain places will have other sorts of support. So in Oxfordshire, we have a thing called Talking Space, which people can self-refer into. And it's stuff that's done either sort of online or over the phone, as well as pre-COVID, you could have face-to-faces as well. So there are lots of things that can be available, but it can depend on where you are. So your GP is probably your main contact initially.
Yeah. These are very challenging times with COVID. And I do know actually that if you go onto the NHS page and pop in a search for psychological therapies, there is they do have a specific page for that, and you can put in your postcode and find out what therapies are available in your area. So do have a look at that. It's called Access to Psychological Therapies, IAPT, I think it's shortened for. So have a look on the NHS website and pop in that in their search engine. So another COVID question here. This is from Alison. Thank you, Alison. Will carers and or family members living with myeloma be prioritised for the COVID-19 vaccination?
So for carers, they can be, and they would be put into, I think it's group 6, where they are looking at the carers. So that's any unpaid adult carer. or anyone who's getting sort of carer's allowance would also be in there, or anyone that is looking after an elderly or disabled person whose social, like their well-being would be at risk if their carer was not able to perform or got unwell. So yes, the carers are definitely people that are being prioritised. Family members, I don't think necessarily, if they're not being deemed a carer, which can make it a bit difficult when you are all taking on the caring role. So I think it can be dependent on GP surgeries as well. There's certainly some people that have managed to get their partners or carer to have the vaccination at the same time as them, but it will be very dependent on where you're living and what the sort of availability is from the vaccine side of things as well.
Yeah. And for a wee bit more information about that, on our website, if you go on to help and support on myeloma.org.uk, we have a COVID-19 information hub. And if you look under there, there's a section on COVID-19 vaccine. You ask questions, and it talks about just what you were saying there, Lisa. So please do have a search of that section of our website there. Last question on this section, Lisa, if you don't mind.
Yep.
And it's maybe a bit similar to one that you've answered previously, but you may have another answer. I would usually get some help from close family members, but this isn't possible at the moment due to COVID. How do I cope with this?
So with that, again, the GP and getting in touch to see what might be available, depending on what you're needing. So there's certainly ways of them referring into sort of an organisation that might be in your area, looking at providing additional help and support for you. Again, some places are still having voluntary services that are still running to help with certain things. But there are also ways of having a look at what's going on in the situation to see if you can extend the support bubble and potentially bring in somebody else into your support bubble to allow you to have that additional support. Again, I think it's very dependent on what's going on with the patient at the time about whether you can extend that bubble.
Absolutely, yeah. Okay, so that's the first lot of question and answers. Thank you for that, Lisa. And okay. If you don't mind, we'll continue on with your presentation now. Thank you.
Lovely. Thank you. So we're moving on to looking after you. So as I sort of alluded to, it is easy to neglect your own well-being when you're looking after someone else. I think that's especially so when that person is a relative or loved one. And we know that myeloma doesn't just affect the person who has it, it does affect the family and friends as well. You have to look after yourself to be able to look after somebody else, which is why it's so important to make sure you are getting additional help if you need it. And your quality of life is as important as the patient's. So the adjustment to a myeloma diagnosis, does affect you and not just the patient. And it has so many impacts on not just your life, but also the relationships that you're having within the family. It can be a massive strain sometimes. And you can feel that you should be okay because you're not the person with myeloma. You're not the one dealing with the actual disease itself. But obviously it is just as important that you're keeping yourself fit and well and healthy to be there for that person so that they know that they can rely on you and have your support. So we'll move on to some practical tips for helping you to look after yourself. So eating well, we all know that it's really important to eat a nice, healthy, balanced diet and drink plenty of water, not skipping meals if you're busy, which can be very common to do, especially if the person you're looking after has a lot of things going on and you're just constantly on the go. If they don't have much of an appetite either, it can be very easy to forget to make yourself a decent meal if they're only wanting something very small. Always making sure you've got some healthy snacks with you if you're out and about, and trying to avoid those junk foods and fast foods because they can make you feel quite sluggish. All generally quite good tips even when you're not a carer, but especially so when you are. And it's really important because it gives you that energy and the vitamins you need to be able to keep going. Sleeping well can be very difficult if you're worrying, or obviously on the lovely steroid days we all know when patients aren't sleeping, if you are together and they're not sleeping, it can mean that your sleep is also affected. Writing down your thoughts or questions. I definitely recommend this for any of my patients and their families. If you're lying awake in the middle of the night, you've got things running around your head, jotting them down, in a journal or anything, just to get them out of your head. I've said to my patients, pop them in an email, send them to me. I don't care if it's 3 in the morning, I'll deal with them when I'm next in the office. But it can be really helpful just to have them out of the head and written out and down. It gets them away from that circular motion that they make in there. Having a good sort of routine for bedtime, so sort of bath or a warm drink just to nicely relax before going to bed. Having naps during the day if you're able to. Obviously, this is something that if you've got a small family with young children, you might not be able to do. And even sometimes with older kids or without any kids, you may have a lot of other things going on, such as work, that would prevent you from being able to do that. And if possible, or if needs be, sleeping in separate beds or separate rooms, if that's what's needed. Obviously, it can feel very hard to do that because you want to be with that person. But if it's having a detriment, if they're not getting any sleep, obviously it has an impact on your moods. And if you're then not getting any sleep as well, you'll both be quite anxious and probably more on edge with each other and more likely to snap at each other as well. And, as long as one of you is getting better sleep, you can put things in more of a perspective. So the practical tips, so getting regular gentle exercise, which can help you with your sleep, and basically give you that little boost of your natural endorphins and everything going around and make you just feel like you've got a bit more energy. Also, if you're able to do this without the person that you're caring for, potentially, so you've got a bit of you time and time out, it can help you with clearing your head. Now, we know that we've got people that go out for walks together, and that's absolutely fine because exercise is just as important for the patient as it is for you. But if you can get some time where you're doing something away and on your own, if there's someone else that can then step in and do something with the person if they need someone there, then it's really important to have that time to yourself as well. Health in general, keeping up with your regular health and dental checkups, following up on any new or existing health concerns. It's so easy to forget about our own concerns when we're dealing with somebody else's and everything that they're going through. And you might just think yours is something very, it's not worth mentioning or doing anything about, but it really is. And making sure you're up to date with things like the flu vaccine to help prevent your loved one from catching that and ending up in hospital even, which can be a bigger deal for them than if we get the flu. So, making sure you let the GP know about your carer status, it helps with these things and make sure that you actually get the flu. You will be eligible for it because of being a carer, so you can get that through your GP. So then looking at the other practical tips for looking after yourself, the you time, taking that time out for yourself, maintaining or taking up your own hobbies and interests, because again, these things can go to the wayside, especially at that crux when you get in the diagnosis, in the midst of treatment, when there's lots of side effects, when relapses are happening. It's all times where these things can just get pushed to the back and then forgotten about. And joining support groups or interest groups, really helpful to have your own little area of support as well, and knowing who you've got there to help you through. So, it can be difficult to get support, and it's really important to know who you can go to ask for help, and asking for that help when you need it. It doesn't mean that you're weak and you can't do this. It means that you're keeping yourself strong so that you can be there for your patient or your relative, your loved one. And it's really important to have that help and not to do this alone if you can. So having other family and friends, they might not realise what's involved with what you're doing. If they're not with you on a daily basis, they might not see the extent of what you're having to do. So letting them know, and they might be able to help out in little things. They might be able to get the shopping for you, or before COVID, help out with some of the things around the house. COVID has sort of not helped in these side of things if you are on your own with your loved one who you're caring for, because you don't necessarily have that additional support coming in to help you. And like I said, that helping and support that you get for you is really important, and it is not a sign of failure. It makes you stronger, it makes you able to do this, and it means that you can continue to do it. And it's really important to talk to your family and friends about what's going on, you know, to know that they're there for you as well as for the patient. You know, it can bring families together, having those discussions about what's happening, people being there for each other. And if you're doing it so well, people just think you're capable and can cope with it, and thinking that you're coping if you're not saying that you're not. So they're happy to let you carry on. The other thing that is available for most places is respite care. And, you know, it doesn't have to be other family members that you talk to. You can take a break. There are places available, certainly before COVID, that you could go to, like a hotel which has sort of nurses and doctors linked with it, that you can go down and have a break, and that's with your sort of relative and loved one. Or, you know, having someone come in for a couple of hours so you can go out somewhere, or, you know, an afternoon off, so that you are getting that you time that is so important. And, you know, if you are really struggling, there are people out there that can do it's emergency care, so emergency respite care that is available if you're struggling and coming into what we say sort of a crisis mode. We don't want you to be struggling with that. You need to just reach out, and help is there, and we can, you know, support you through this. Now that's it normally follows a carer's assessment, the respite care, but things can be done in an urgent matter if you are in a sort of a crisis mode at that time, that things can be done very quickly. So looking at coping mechanisms. So remember the positives that you've gained from caregiving. You know, you're there to support them and help them through this. Having your own support system, so you know who that you can turn to when you need to, and having that sort of knowing who that is as early as possible is really a good thing to do. Now, sometimes you will find that who you think is going to be in your support system isn't who's going to be in your support system. You will find out the people that you can rely on. Definitely reach out before you reach that crisis point. Make sure that you're asking for the help when you need it. Being kind to yourself and treating yourself how you would treat a friend in the same situation. Remembering the advice that you'd give to somebody else if they turned to you and said what they were struggling with. Speaking to others in similar situations. So, you know, there are ways of getting in touch with other people who are carers as well. And just thinking about your mindfulness, knowing that things like counselling and CBT are there if you need them, as ways of trying to cope with what you're going through. So supporting patients at home. Asking to attend appointments. Now, obviously, again, COVID has made this a little bit more tricky. Being there, if someone's having a phone call, it's not the same, but, you know, if you've got a speakerphone, you can do that. We have video appointments, which means that you can be patched in as well and all be there. And obviously we do still have face-to-face appointments where it is on a case-by-case basis and a patient-by-patient basis about whether someone can be with them. But certainly if we're able to, we are still allowing relatives to come with, or, you know, carers to be with those people. Now, we know that people can be reluctant to tell their teams about all the side effects and symptoms, and that could be down to fear of treatment being stopped because of it, or, you know, just in general not wanting to sort of make waves or be a problem. So if you're aware of some side effects and symptoms that are going on, please do let us know as well, because we can help, and that's what we're here for. And we are, as part of the medical team, we're here not just for the patients, we are here for the carers as well, to come to us if there's any questions or concerns that you have. And sometimes you've noticed something in a patient's behaviour that we haven't, or, you know, you've seen something that's going on before we have. You know, knowing who to contact and when, so be it the specialist nurse's details, or if a hospital has a triage unit, knowing which number is your first point of contact for certain things. Preparing notes or a list of priorities to discuss for your clinic appointments. Again, really helpful, but we know even when you bring along a list, it's still very easy for those things to sort of be forgotten. Asking the nurses to run through the treatment with you and what side effects to look out for. When we go through this, it's a lot. We know there's a lot of tablets involved. It doesn't all sink in. And we are more than happy to go through things more than once, as many times as it takes for things to sort of really settle in. And having a diary and dosset boxes can be helpful. Dosset boxes can be really helpful, but obviously from a chemo side of things, the chemo can't go into the dosset box, so there's still separate boxes as well as the dosset boxes. But they are a really good thing to have if we think about the amount of tablets that there are. Then quite a big thing that people can be worried about is work. So if you are working, talking to your employer as soon as you know what's going on, more about what they require and what the long-term care requirements are going to be, it's really important to do that as soon as you can. And if you are living with that person that you're caring for, you do have the right to ask for flexible working hours. You can also get unpaid time off in an emergency. Now, most people, you've got the benefits teams in most places are very good people to talk to about other things that you might be able to help with from a financial side of things as well. And we definitely advise all of our patients and the carers to have a chat to our benefits team at diagnosis, as well as when we're going through. Most people think that everything's fine, especially if you've got savings, but we know the impact of this can be so, well, it can just affect everything. And when you don't think your work's going to be affected, we don't know how everyone is going to react to the treatment. And so for someone where we go, oh, it's a well-tolerated treatment, somebody might have horrific side effects and it has a massive impact, and you're not able to go to work because they're not able to do what they would normally be able to do. And obviously, if the patient or the person that you're looking after themselves has had to give up work, it's going to have a massive impact as well, because you've gone from potentially having 2 incomes to 1, or they may have gone from full-time to have to drop their hours. And that can be very scary when you're not sure about the financial future of things. So knowing who to talk to. So, as I said, the benefits, what you might be eligible for. Obviously, it can depend on a number of things, so age, earnings, savings, and other benefits that you might already receive. But it's always a good idea to have a look into these things, because there can be something that you're not aware of that you would be eligible for. Now, I know, people don't necessarily want to go for the benefits, but it's really, really important to look at these things and not to struggle through if you don't have to. So they can't discriminate under the Equality Act. So carers who are also employed are protected under these acts from direct discrimination and harassment in the workplace. So, if your employer is not being overly helpful, then you are covered, and they need to be able to provide you that flexibility under that Disabilities Discrimination Act and the Equality Act, that they can't deny these things.
Thank you, Lisa. So we've got time for more questions, and thank you to everybody again who has submitted questions. We do appreciate that. And one question that was submitted there in response to that last couple of slides there, Lisa, was, why can't chemotherapy tablets go into dosset boxes?
So it's down to, this is when I forget what it's down to. It's to do with how well they will, so the degradability of the tablets themselves. So they have it's like half-lives and everything, and you don't want them touching everything else. So they can't go in with anything else. And technically, depending on who's dealing with the dosset box, chemotherapy should only be handled by the person that needs to take it. If you are dishing out the tablets to the person, to your loved one or relative, if it's the chemotherapy, ideally you should either have gloves on whilst you're doing it, so the gloves that we have in the hospitals and that, so that you're not touching it, or where possible do it so that you're not touching it and you're pushing it out straight into either the little pot for them to take it or into their hand. But it's down to chemotherapy itself and how it's made. We just don't know the stability of it either alongside other tablets. It's the bane of our life, really, not being able to have them in dosset boxes.
I'm quite sure. Yeah, thank you for that.
That's
so
okay.
The next question, I'm pretty sure you covered it on that last bit of the presentation there, Lisa, but it might be worth reiterating. We've got a bit of a heartfelt question here, and the question is, I'm struggling to cope on my own, and I'm not sure who to ask for help.
Yeah. So when you're struggling on your own, again, would say your GP would be a really good person. If you don't have, if for whatever reason you can't get hold of the GP, you can obviously get in touch with your CNS. We are here, not just for the patients, we are here for the carers as well. And we can, again, signpost where needed and look at these things. Like I said, there is certainly in Oxford, in our Oxford carers side of things, if someone is at a crisis point, we can get emergency respite care in. So there's normally a form and an assessment that gets done. But if it's at a crisis point where actually something needs to be put in place and quickly, it can be done, and it can be done extremely quickly. So, it is about, if you can't get hold of the GP for whatever reason, get in touch with the medical team, we can help. But your GP should be the first point of call. Again, depending on what the reason is, if it's to do with more of a mental health side of things, is looking at other things that are available. But if it's more of a physical, actually, there's a lot of physical caring required. You need the GP. They've got a load of other community-based services that could be helpful.
Yeah, thank you. It's a tricky one, isn't it, when you're trying to cope on your own. But I think as the weeks and months go by after the diagnosis, you begin to realise that that you're not alone, that there is help out there. You just have to speak up, I guess, as well. So again, I think this one you may have covered in the financial slide there, but Pamela asks, if I need to give up work, how and what financial help is there?
So I think, again, we would probably say if that was looking like it was needed to be, needing to happen, we would definitely recommend talking to the benefits advisors. Now, we have in Oxford, we have benefits advisors linked to our Maggie Centre, but we also have Citizens Advice Bureau benefits officers that are linked with Macmillan. And we would definitely recommend talking to them, and they're very good at going through everything. And we'll look at things as well and help go through those forms. The forms can be very daunting, and having someone to help you through that can be really, can really help the process. But certainly we would definitely recommend that side of things, and talking to someone from the benefits team to go through if they were needing to give up work.
Thank you. Yes, indeed. So the next question is quite a common one that we hear, and we know that not everyone copes in the same way, and even within the same family group, two people can cope in different ways. So this question is, my partner is not interested in seeking out more information or support. What can I do on their behalf?
That's an interesting one, because actually we do see that where the patient themselves doesn't want to know, isn't interested in knowing. But as the carer, do go out and find that information so that you're empowered and because actually a lot of that can be down to the shock of getting a diagnosis. And it can be a case of, at that particular time, they don't want to know anything, but they might slowly start to ask those questions. So I think reading around it and getting the information for yourself is an important thing to do if you're wanting to know more about it, because they might start asking those questions. And it might be that it's not whilst they're in clinic, and it is just randomly starting to ask you those questions at home, or having more of that conversation. And if you've got that information there, you can it's almost like drip feeding it in, rather than it being a big onslaught of information, really.
Yeah. What we often suggest is, and we get this quite often on the helpline as well, is for people to have a few of our publications just dotted around on the living room table, so you can pick it up and read what you need at that point, and then put it down, so that it's kind of visible. And you're not forcing anything on anybody, but if there's a spare few minutes in the evening, they may just pick that up and then realise that the information is absolutely power. Yeah. So this next one is a bit more of a practical question, Lisa. I get annoyed that my partner doesn't help around the house. I know the experience that he experiences some fatigue, but I feel like I'm doing 100% of the work. I feel guilty thinking about like this, but how can I manage these emotions?
So I think that's where it's that communication with each other and having those conversations. Fatigue is such a difficult one, because it can be so overwhelming, and it's also the one that lasts the longest. So it's constantly there, and trying to get, again, into patients or people's mindset about that, trying to make sure that they're doing something every day, and trying to keep active being the best way of managing and combating fatigue. but actually having those conversations with them, because they might not be aware that that's how you're feeling. Obviously doing it in a tactful way, so trying to get there before you're feeling too bad about it and too wound up about it. But even just, having the conversation saying, okay, on the days when you're feeling a little bit better, maybe you could do X, Y, or Z, and I'll do this. And having almost like a little rota type of thing and going, well, it's an idea, but actually if you're having a really bad day, that's fine. But then on a slightly better day, getting involved with it. I think it's really, 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 really hard.
Yeah. I think that sounds like a good idea, though, just having a bit of a rota and saying how you feel, because they may not necessarily know. If you don't say it, then it's not apparent all the time. So
yeah.
Okay, so this next one is again a COVID-related one. Is it advised for carers to still distance themselves from friends and families until they receive the vaccine in order to keep the loved one that they care for safe?
Unfortunately, yes. And I know it's really hard because you want to be seeing those people, but it is really important. Now, once we've all got the vaccines, that's fine. But obviously, if COVID is still around, we're still going to have some elements of having to keep ourselves safe as well. But yes, until everyone's sort of had the vaccine, it is really important that we're still maintaining the distance that we've got at the moment, and keeping our distance from people, which is difficult. And it's very hard, especially when you are caring for someone, and more so if you are the sole carer and have nobody else around in the house to help.
Absolutely. Yeah, absolutely. It's so important, though, and maintaining the stringent hand washing, and if you are out and about, the mask wearing, all still very important.
Yeah.
Last question, really. I'm just checking that we haven't received any other questions. So this one is, are support groups just for patients?
No, they're not. So the support groups, and certainly our support group, is very welcoming of carers as well, because it does allow carers to get support from each other. And I think it's really important to have both carers and patients there, because again, there can be, seeing from a patient's perspective, seeing what carers are going through and what their perspectives of everything is, can be a real eye-opener for them as well. So I think, being aware of that and knowing that, you are able to go along to those support groups with your relative or loved one.
Absolutely. I've been to a few support groups where everybody's welcome, and it's not just being informed and supported, it's a social thing as well. They often have social events. So,
yeah.
That's all the questions we have time for now. Thank you so much, Elisa. So now we're going to show a video. This is a short video that was filmed in 2017, where Marion and John Harris discussed the effect John's myeloma diagnosis had on Marion and how she manages in her role as a carer. So I'll let the team get this going.
My name is Marion Harris, and I've been married to John for 52 years. We've got quite a good relationship, haven't we?
Oh, Marion used to work for the local GP, and for appointments and things, she's got them all written down on a calendar, so she knows. I'm terrible. I never even think about it once they've been made. And I couldn't wish for anybody better than that. I really couldn't. She prods me along there to get me going.
Shouts at him.
Well, yeah, on occasion.
We do share, don't we?
Yeah.
We've been together such a long time. We decided that we got to make the most out of life. We needed to be together because we didn't know how long it was going to be. So it changed the fact that I was now at home all the time, which had not been for donkey's years. And that was hard to get used to, not seeing people every day and talking to people every day or challenges every day, So that was a bit hard to start with. Sometimes it can be hard work because, say, have you taken your tablets? No, I'll take them in a minute. No, take your tablets now. And that I can understand. You must get fed up with swallowing tablets and things, but and we just support each other, don't we? Because sometimes, you know, I can get down, you know, and think I can't keep doing this, but then, you know, you're there, aren't you? So
well, I try to be.
we
Yeah,
just, and as I say, we've got fantastic children and grandchildren, and I do have trips to the theatre and things like that, you know, but and I did go to New Zealand last year to see my godson who was just being born, and that was lovely. My granddaughter went with me, and we got a carer for John, you know, somebody we knew, but she came and stayed with him for 3 weeks. So I did do that last year, and that was fantastic. There's very good support in Nottingham. The carers group is really good. I do know the carers are there if I ever do need, you know, to talk to people. I mean, I think the main thing is that we've found is just to carry on, you know, and I know things have changed a lot, and I know things have perhaps even changed more. But as far as the cancer goes, it's just living with it, not dying from it, living with it. And that's how I feel, you know. We're both living this. John's not dying from it, and that we're going to make every day as normal as possible and just work everything I have to do into a normal day so that it now becomes normal, and we can carry on like that. You know, it's not thinking, oh dear, I've got to do his injection. That's going to be part of my evening routine. You know, whereas before I'd make him a cup of coffee, now I'll give him an injection. But I think that's the easiest way to cope with it. Just work everything into and make that your routine, make that your normal day rather than what you used to do.
That was really, really nice. So, you know, at Myeloma UK, we have a whole range of resources for patients, for family members, for loved ones, for anybody really. We have resources for healthcare professionals too. So we have our helpline, of course. We have Ask the Nurse email. We have a range of publications. And over and above Myeloma UK, Elisa mentioned right at the beginning that there's Carers UK. Citizens Advice Bureau is always a wealth of useful information, and they can navigate you around the complex forms for finances. And they're often a great source of support as well. Macmillan Cancer Support, they always have benefits advisors on their line. So if anybody's seeking kind of specific financial answers to their questions, sometimes Macmillan, there are Macmillan units usually in hospitals as well. And for looking after your mental health, there's a lot of organisations. I mentioned the NHS website where you can look for psychological therapies in your area, but Mind is a good is another good resource for your mental health. So these are some more of the Myeloma UK resources, specifically for carers. We have an info pack for carers. This one is very popular and it's used very well. The wee book there in the middle, the small things that make all the difference, are actual quotes from patients, family members, friends. We didn't make any of the quotes up in that booklet. They all come from genuine people. So have a wee look at that one. And there's an info pack for living well with myeloma. So just looking more at the day-to-day practicalities. And the helpline, which I answer, as I've said with Sarah and Kim, we speak to lots of patients and families every day. We're here to clarify anything you're not sure of. We're here to be a listening ear, and we're here to answer questions. We do have expertise in myeloma, and I am a trained nurse as well, and I have been for many years. But I've been at Myeloma UK for a long time now. And there are support groups. Have a look on the section on our website for support groups. A lot of them aren't meeting face-to-face because of COVID, but I do know that there are those who are having virtual sessions, so check those out as well. And of course, there are digital info sessions like this as well. We will be having more of those. There's a discussion forum on our website as well, where where you can chat to others, share experiences and ask questions. It's not the busiest of forums, and we are in the process of kind of refreshing and regenerating that. So but do have a look at that forum. So we've come to the end of the webinar for today. So thank you so much to Lisa for giving that presentation and for answering all of those questions. You're an absolute star. We really appreciate that. And thank you to everyone who's joined us this evening. We hope you found it helpful and informative. If we didn't get around to answering your question today, I'm sorry. Or if any questions have been thrown up because of the webinar, please do get in touch either on the helpline or via our email service, askthenurse@myeloma.org.uk. All of those details are on our website. And keep an eye on our social media and website for announcements of further digital info days. And I'd like to thank you all for joining us. Please keep safe and have, I hope the rest of the evening's good for you. Take care.